Hello and welcome, everybody. We are extremely excited to welcome all of you to the inaugural symposium of the TeleRobotic Surgery Leadership Council. We hope will be the beginning of a continued and very important journey toward the future of medicine involving telerobotics. We are honored to present a two-part symposium. The first will be clinical work presented by Professors Pedro Adragao in Lisbon, as well as Professor Carlo Poponi in Milan, where we will have the unique opportunity to watch them participate in each other's procedures. This will be followed by a discussion session led by several members of the Leadership Council. I would like to start off with an introduction of Dr. and Professor Carlo Poponi, who is in the lab in Milan. And for the first procedure, we'll be presenting a patient with atrial fibrillation who will be operated on with the assistance of Professor Adragao, who will be initially in his office in Lisbon.
Good morning to everybody. Good morning, Dr. Weiss. The aim of this symposium is not to demonstrate the efficacy or the method for the ablation of atrial fibrillation, but just to show the potentiality of this technology to perform remote mapping and eventually remote ablation.
He's a 62 years old gentleman. He's suffering from episodes of atrial fibrillation, relapsing and remitting, refractory to several trials of antiarrhythmic drugs with propafenone and amiodarone. This is the standard 12-lead ECG during sinus rhythm, and this is the last episode of atrial fibrillation for which he was admitted to our emergency room in these days. Here you have the transesophageal echo performed today. You see by the video that the left appendage is quite free, no smoke effects, as well as the left chamber looks like pretty normal with preserved ejection fraction and only trivial mitral regurgitation. So this patient has been today scheduled for this procedure.
Professor Adragao, did you find it reasonably easy to move the catheter when you were doing the mapping?
Not only easy, even with the support of your technician, it works well. And I think that the voltage near the appendage always is a little bit higher, so it's the case. In fact, I would like to see if it could convert with the special applications near the coronary signs.
And did you feel comfortable having Professor Poponi move the catheter during the ablation? Again, he was just working, in a sense, he was doing the, manipulating the catheter like he would with mapping. However, ablation energy was turned on. So was there a comfort level there with that catheter movement during ablation from afar?
We were completely comfortable because it placed the catheter nearby the area that we had identified. So for us, we are completely convinced that he was right.
This is a wonderful experience. Today is an important day.